What foods should you avoid if you have gout? Hello, this is Dr. Siddharth Dambar, expert in rheumatology and in regenerative medicine. Gout is a condition that causes inflammatory arthritis, which means inflammation in the joints and the tendons. It's caused by having uric acid crystals in the joints. That in turn is due to having a high level of uric acid. Uric acid is a normal breakdown product of the body of purine metabolism. If you have too much uric acid level in the blood, it can lead to crystals where you have deposits of uric acid and crystals into a joint or a tendon, which then cause inflammation in the joint, and that is gout. So traditionally we utilize medication to reduce your uric acid level. Keep in mind that dietary inputs, what you put into your body, is what causes high uric acid. What foods and drinks can cause high levels of uric acid level, and should you be careful of? Look, if you look online, you're going to find most foods can increase your uric acid level. And the reality is there is some truth to that. However, there are some clear-cut foods and drinks that are more problematic. And these are the ones that I'd recommend trying to minimize or avoid or moderate at least. Number one, red meat, organ meats, big red flag. You really want to minimize those. Those really drive up your uric acid level. Alcohol in excess can definitely also increase your uric acid level. Beer in particular is a problem. Seafood, in particular shellfish, anchovies, and sardines, should also be minimized. Those are the three big ones. Some other things to keep in mind: if you consume a lot of sugary foods and drinks, they tend to have a lot of fructose corn syrup. That in turn also leads to higher levels of uric acid level. Now, there are other reasons to avoid these foods if you have gout as well. So we know that gout is associated with heart disease. All these medications that all these foods and drinks that I just mentioned are also associated with heart disease as well. And in the case of gout, that's due to chronic inflammation. These foods increase your level of uric acid level, which then leads to higher levels of inflammation, which then contributes to heart disease as well. In addition, uric acid levels being elevated, and gout in particular, are associated with metabolic syndrome as well, meaning diabetes, fatty liver. All these things are in part treated by minimizing some of those foods that I mentioned. Keep in mind that diet is important even if you're on medication for gout, even if your uric acid level is controlled. I have a number of stories and cases of patients who have gout, they're on medication, they're doing great for years, and they go on vacation, they drink too much alcohol, eat too much red meat, and we get a call saying that now their foot and their ankle is inflamed and flared up and their gout is basically out of control. That's really because that even if your uric acid level is chronically under good control with medication, if you're dietary non-compliant, you'll still get spikes of your uric acid level, which is what then causes a gout flare. Gout, it's a condition that can be incredibly painful. There's good medication to treat it, and you need to be very conscious of what you consume in terms of putting into your body, and that includes minimizing red meat, alcohol, and shellfish, and sugary foods and drinks if you want to keep your gout under good control. If you found this helpful, please give us a like and subscribe to the channel. Until we connect again, have a good day and live well. Bye-bye.